Okay, so I'm going to show how to do an IM injection. The first thing I'm going to do is check the physician's orders, and he ordered Visceral 50 milligrams IM now for nausea. And I'm going to check that against my MAR, which is Visceral 50 milligrams IM now, so that is correct. And then I'm going to go to my Pyxis, and that is an antiemetic, and that is located in D3. So I'm going to go ahead and gather all my supplies. Okay, I'm going to check my medication again. And I know that hydroxine is Visceral, and it is ordered, the vial is 100 milligrams per 2 ml, so that I know that I need to do a little bit of math. And if I want 50 milligrams, I'm going to have to give 1 milliliter. And I need to scrub the top for 10 seconds. Because that is a reusable medication. And I'm going to check my syringe, and this is a 3 ml syringe and a 21 gauge by 1.5 inch needle. So the first thing I'm going to do is recap my syringe. Take off the needle. I'm going to draw back 1 milliliter of air. Go straight down. Put my air in the vial. And draw back 1 milliliter of medication. I'm going to scoop and re-scoop the needle because it has not been in another patient. And I will label that. Paul Brown, 1 ml Visceral, a date. Okay, and I'll bring my supplies to Paul Brown's room. Good afternoon, Paul Brown. How are you doing today? Okay, so can I have your name and date of birth, please? Paul Brown, 5'4", 19XX. That's okay. And I see that you're allergic to penicillin, is that correct? Perfect. The doctor says that you are feeling nauseous, is that correct? Okay. We are going to go ahead and give you Visceral, which is an IM injection. Do you have any questions before I give that to you? Okay. Have you had any shots in your arms, buttocks, or your thigh? No? Okay. So the 3 locations that I can give this injection to Paul Brown is in 1 to 2 inches below the chromium process, which is about 3 fingers, and it is right here. I can give it in the ventral gluticle, which is 3 fingers below the greater trochanter and 3 finger whips above the knee, which is this area right here. And this is actually the vastus lateralis. And the the ventral gluticle is actually right here. And you put your hand above the greater trochanter, and you form an L, and it is anywhere in this area right here. And I'm going to go ahead and give that in the vastus lateralis. ahead and do my third check, which is Visceral 50 milligrams I am now, and that is what this says. Okay, and I'm going to scrub the area from inside to out. I'm going to take the needle and dart straight down. I'm going to Z-track first, then take the needle and go straight down for about 10 seconds. And take about 10 seconds to pull up. And there is no blood, so I won't need a Band-Aid. I'm going to go ahead and throw out my sharps. This medication does cause dizziness, and it takes about 30 minutes to kick in. So if you need to get up and use the restroom or anything, can you please use your call light? Do you have any questions before I leave? Thank you. I'm going to go ahead and document location, the date, or the time, and my initials. And then put my name on the bottom. The two nursing diagnoses that I will have are risk for impaired skin integrity because he did just have an injection, and risk for falls because a side effect of the medication is dizziness.